Welcome back to the Horizon Line podcast, brought to you by Horizon Behavioral Health. We're going to talk about school-based services today, and it's just a quick episode. And I have Grant Tomey here with me. And Grant, why don't you introduce yourself?
Sure. Thanks, Ryan. Yeah, I'm Grant Tomey. I am a clinical coordinator for school-based services, specifically in Bedford. Basically, half counselor and half manager. So yeah, been doing this for about 4 years now.
Yeah, so Grant, why don't you tell us just about what school-based is and what you do on a daily basis?
For sure. So school-based counseling essentially looks like traditional office-based counseling, what you think of when you go to an office and see a therapist or case manager. We're just directly in the schools. And the benefit to this is it's much more accessible for students and their families. As we know, there are a lot of barriers to getting mental health services, and a lot of that comes down to time during the day. It's difficult for kids to get in during their school day without missing school. So school-based services allow the kids to get services in school and not miss a tremendous amount of class.
Yeah, it's great that these kids can get help right where they are and they don't have to go somewhere else or leave school, miss school, figure out transportation. That's a whole different story. So that's great. So do you meet with, I guess you meet with kids one-on-one most of the time in the school. And then how does that work? How does someone get connected with school-based services?
For sure. So you can dial our admissions line. It's 434-477-5000. You can also go on our website to get information on how to access our services, horizonbh.org. But essentially what the process looks like is you'll be helped to get an appointment for an assessment, and you'll meet with a clinician who will figure out what issues your child is facing and how we can best help them. And school-based services very well may be something that's recommended at that point, particularly if there's issues seeking services before or after school.
And right now, I think we're in 21 schools in the area. That's really great. And I think we've served over 3,000 youth in the last year across all of Horizon's programs. So is there anything that you've seen like data-wise in your work or any trends that we should be aware of?
So we have seen a dramatic increase in mental health issues among youth within the last, well, at least within the last decade, and certainly since the onset of COVID. So school-based mental health services really improve that accessibility and just being able to see more kids than a traditional office-based model is able to provide. So it's just kind of meeting the needs of the community.
Awesome. And then I know you've probably worked with a lot of kids at this point over the last 4 years. Is there anything that you can share with us, like a success story or a client that you've really connected with without any, personal identifying markers?
Sure. Over the last 4 years, I've had the benefit of directly serving a number of students. Myself, elementary and middle, have not had the privilege of serving high school students. But I've also, supervised countless cases, K through 12 now. I'm thinking of one specific student who I started with first year. This was actually at Bedford Elementary School. Let's see. He was, I believe, in third grade at the time and just very kind of shut down. I think feeling very alienated from peers, from authority figures at school, sometimes even from family. Home life, very chaotic, unstructured. Death of a father due to drug use when he was much younger. So if we've heard of ACEs, the adverse childhood experiences, he was racking up those points. But that first year was really rough. In and out of principals' offices, sleeping in class. That was a regular occurrence. And if he was sleeping, well, that was kind of left alone because we're not being disruptive. But, as the year progressed, we gained rapport. I gained rapport with the school personnel, principals, teachers, and we were able to help him communicate what it is that he needs and start to get on a better footing with the school. He ended up being enrolled in an advanced math class. I think it was 2 grade levels ahead, which was a real
Hmm.
win for
Yeah.
him, and really started to identify what his strengths are, and how he fits in. And now he's in middle school. He's at Liberty Middle School, and we still have our difficult days, but the improvement in his mood and just in his success at school, both academically and socially, is just really great to see,
That's awesome. Thanks for sharing that.
for sure.
So obviously you work with these kids a lot, but they're not always going to be in school forever, right? So how do you connect them to other services?
Right, for sure. So a lot of school-based work is connecting to other services or resources. As you said, they're not going to be in school forever. Also, the school day is 6
Right.
hours. So, really from the jump, from the get-go, we are looking to connect to other mental health services, whether it be through Horizon, or other community mental health agencies, or we're looking to connect to other natural supports in the community. One great feature of school-based mental health services is we have case managers in almost all of our schools, along with our
Yeah.
therapists. So a lot of that connecting work is done by our case managers. Case managers not only see our kids regularly for supportive level counseling, in person at the schools, but they're doing a lot of behind the scenes work of trying to connect to those other services and resources for our kids.
Well, that's great. So if there was a kid listening to this podcast right now, maybe they're going through some similar struggles to the person that you shared about. What would you recommend this kid do to get connected and find help?
Yeah, I think, identifying a trusted adult.
Yeah.
They could already know someone with Horizon, or they could know a friend. Kids will talk, and I'm seeing so and so. They can reach out to someone at Horizon, but really any trusted adult. This could be a teacher, this could be a school counselor, could be a parent at home, and just reaching out for that help. And as far as adults, where they can find information, they can go on our website, horizonbh.org, or they can call our admissions line or come in, and someone from Horizon, a clinician, can help guide them in the right direction.
Yeah. And like you mentioned, like a parent or a teacher, trusted adult who interacts with a kid a lot, what are some common signs and symptoms that they might see in a child who's struggling?
Yeah. So any major change in their behavior or mood, if you're a trusted adult, I would expect that that kid, what their tendencies are. So any major change in behavior, and some of those that we're looking at are irritability or anger. We see kind of that externalizing behavior more often in kids than adults. So it might be chalked up to him or her being disrespectful or moody, but that's common. We also see isolation, withdrawal, staying holed up in our room, though, teenagers do want their space. If you see a major change there. Also, with kids, particularly younger kids, we're looking at a lot of physical complaints such as headaches, stomach ache, malaise, tiredness. A lot of times with younger kids, they don't know quite how to conceptualize emotional issues, so it kind of comes out physically. So you might, these kind of complaints that we don't know where they're coming from. Obviously, see your doctor for physical complaints, but it can manifest that way. And lastly, I would just say school performance or attendance, seeing changes, because a kid's job essentially is school. Right. So any major changes that we're seeing there, declining performance or isolation or truancy. Mental health issues in youth have been on the rise, unfortunately, for a number of reasons. But, that means you're not alone. Your kid is not alone. And there are resources to help. There are people that want to help. Horizon's a great place to start, in addition to a lot of our other community health providers in the community. The sooner the better, and keeping an open line of communication with your kids. So when so when there's an issue, when to address it, and the sooner the better.
Yeah. Yeah. If you'd like to reach out to Horizon and you're listening to this episode, you can find our phone number and website in the description. I also want to remind everyone about the 988 suicide and mental illness hotline. It's 3 numbers, 988. You can call and text or even chat online at any time, speak with a real person. It's free and confidential. So it's a great resource that anyone can reach out to and use. But Grant, thanks so much for talking with me today. And we'll have you in for another episode. what
Oh,
I'm saying?
appreciate it. Thanks, Ryan.
Thank you for joining us on the Horizon Line today. If you found today's conversation helpful, be sure to subscribe so you never miss an episode. You can also follow Horizon Behavioral Health on social media for more resources, stories, and updates. Until next time, remember, hope and healing are always on the horizon.